This presentation is on diagnostic tests for cardiac assessment. Several tests can be conducted to assess cardiac function. Blood pressure and heart rate are the most common tests. The other tests listed here are conducted to assess heart muscle performance or pathology. We will discuss each in turn. The standard chest radiograph should be taken at full inspiration in order to depress the diaphragm and provide better visualization of the heart. The heart should occupy 1/2 of the transverse diameter of the thoracic cavity. If the heart is enlarged, that is, if cardiomegaly is present, this will show up on the radiograph. Because the heart is rotated and tipped within the mediastinum, the right ventricle occupies the majority of the anterior portion of the heart in the frontal view. Knowing the location of the chambers of the heart can help guide evaluation of chamber size. Impressions of the major blood vessels can also be visualized. The electrocardiogram, called the EKG or ECG, provides a graphic display of the electrical activity of the heart. The P wave depicts the atrial depolarization and the QRS depicts ventricular depolarization. Repolarization of the ventricle is depicted in the T wave. Repolarization of the atria is not visible on the EKG as this waveform gets lost within the QRS complex. The EKG records timing for electrical events as well as the amount of voltage generated during the electrical events. These details will be studied separately in the EKG unit. This tracing and electrode setup shows a typical 12-lead EKG. The 12-lead EKG includes 6 limb leads and 6 chest leads. The limb leads are leads 1, 2, and 3, along with the augmented leads right, left, and inferior, shown here as AVF. The chest leads are called V leads, and they are numbered V1 through V6. The 12-lead EKG provides a thorough picture of electrical activity throughout the heart in both the frontal and transverse planes, which helps the cardiologist identify the location of pathologies that impair normal electrical activity of the heart. Exercise stress testing is done to help determine the physical activity tolerance of a patient and to diagnose coronary artery disease, as well as to assess for the presence of myocardial ischemia and dangerous arrhythmias associated with physical activity in patients with pathology. Repeat exercise testing provides information regarding the impact of interventions. For the exercise stress test, the patient walks on a treadmill or rides an exercise bike while their heart rate, blood pressure, electrical activity, signs and symptoms, and rate of perceived exertion is assessed. Various protocols are used to progressively increase the workload for the patient. A popular testing protocol is the Bruce protocol, for which the patient walks on a treadmill while the speed of walking and steepness or grade is increased in incremental stages. The test continues until the patient requests to stop or until abnormalities are identified. Some patients cannot tolerate walking or biking due to physical limitations. In these cases, pharmacological stress testing is conducted. With this test, cardiovascular stress is induced by pharmacological agents such as dobutamine. This drug increases heart rate and therefore oxygen demand similar to physical activity. Dobutamine is infused intravenously and the dose is increased gradually until a maximal dose or endpoint is achieved. Endpoints include new or worsening of chest wall abnormalities, an inadequate heart rate response, serious arrhythmias, angina, significant ST segment depression, intolerable side effects, and a significant increase or decrease in blood pressure. Echocardiography is a non-invasive procedure that uses pulses of reflected ultrasound to evaluate the functioning heart. A transducer that houses a special crystal emits high-frequency sound waves and receives their echoes when placed on the chest of the patient. The returning echoes, reflected from the intracardiac surfaces, are displayed on ultrasonography screens, giving real-time images of the beating heart. Tilting of the transducer at various angles allows the examiner to evaluate several aspects of heart function, including the size of the chambers, the thickness and integrity of the septa dividing the chambers, the contractility of the heart, along with the function of the valves and the function of the left ventricle. Estimates can also be made of end diastolic volume, end systolic volume, and ejection fraction. In some cases, a transesophageal echocardiogram may be performed to allow for better visualization of the heart. In this procedure, the patient begins to swallow a specialized transducer probe and is given anesthesia and a sedative to minimize discomfort. The probe is inserted into the esophagus and positioned just behind the heart. Transesophageal echocardiography allows for improved visualization of the cardiac structures, allowing for more specific evaluation of disease processes, such as those affecting the heart valves or affecting the heart septa. To assess the heart for ischemia or for assessing of heart function in general, radionuclide imaging may be performed. In these tests, the patient is injected with thallium or technetium. Specific tests include myocardial perfusion imaging and multiple gated acquisition scanning or MUGA scanning. Myocardial perfusion scanning can be conducted with the patient at rest or immediately after exercise, or after the administration of a pharmacological agent that affects the heart similarly to exercise as with pharmacological exercise testing. With this test, the patient is injected with a radioisotope, and then the patient is placed in a scanning machine that evaluates the uptake of the radioisotope in the heart. Areas in which there is poor uptake of the radioisotope indicates areas of poor perfusion. With the multi-gated acquisition scan, the patient is injected with an isotope, and then a computerized camera makes a video of uptake in the heart in combination with an electrocardiogram. This scan allows for very accurate evaluation of ejection fraction. Other diagnostic tests include magnetic resonance imaging, which gives a good picture of the morphology of the heart, cardiac blood flow, and myocardial contractility. However, this test is not as commonly used due to its lack of diagnostic accuracy compared to other tests. Positron emission tomography may be used to evaluate the metabolic function of the heart. Computed tomography is used to identify masses, aortic aneurysms, and pericardial thickening associated with pericarditis. Invasive monitoring is important to evaluate the status and progress of a patient. Arterial lines may be inserted into major large arteries such as the brachial, radial, or femoral arteries. These lines are used to directly monitor blood pressure and to acquire blood to evaluate arterial blood gases. The pulmonary artery catheter may be used to assess heart pressures, in particular pulmonary artery wedge pressure, also called pulmonary capillary wedge pressure. The pulmonary capillary wedge pressure can indicate pressures in the left ventricle as long as no pulmonary disease is present. Central venous pressure provides important information regarding pressures affecting the right side of the heart. To assess central venous pressure, a transducer is inserted into either the subclavian, basilic, jugular, or femoral veins. On the top row are pictures of an arterial line inserted into the femoral artery and into the radial artery. The bottom row of pictures shows the insertion of a pulmonary artery wedge pressure line, also called a pulmonary capillary wedge pressure line. In this case, the line is inserted into the large veins in the neck. A very common test to evaluate for blockages in the coronary arteries is the coronary catheterization test. In this test, a catheter is threaded through the femoral artery in the groin or through the radial artery in the arm into the aorta, and then into the right or left coronary artery. A dye is injected, and computer imaging allows for observation of the flow of blood through the artery. Blockages of blood flow are identified on the images. Here is a schematic showing the coronary artery catheterization procedure. This test is also called an angiogram. In this presentation, we have discussed several diagnostic testing procedures to assess cardiac function. You should be familiar with the names of the tests and their primary uses.